momentarily. I'm just going to go over some quick housekeeping. So this webinar is recorded. We'll send out the recording and slides to you to the email that you registered with. We'll also upload the presentation or this whole webinar actually to our YouTube channel at the National Coalition for Homeless Veterans. Again, all of our past webinars and other content lives there. So if you haven't hit subscribe yet, go ahead and do that. Chat is disabled as always. So if you do want to interact with our panelists today, go ahead and use that questions box. So if you have your go-to window merged, it should be on the very top of your screen in the little square. There's a question mark inside. So ask questions whenever you wish. We do have a Q&A portion of the webinar at the last maybe 10-15 minutes of our hour. So you could either hold your questions then, or you can ask them whenever you wish. But yeah, we're going to go ahead and get started. My name is Jay. I'm the program associate for the National Coalition for Homeless Veterans, where it's our mission to end veteran homelessness. I'm actually really excited for this discussion today because we're going to go over various programs that meet veterans where they are and connect them to vital services. I also want to acknowledge the Home Depot Foundation for their generous support in sponsoring this webinar, in addition to just being impactful leaders in the mission to end homelessness amongst veterans. So a veteran being hard to reach can take many forms and doesn't necessarily mean that a veteran doesn't want help. So our engagement with veterans can often be shaped by a combination of individual circumstances and, how programs are designed and carried out. So many of you already know that a veteran's connection to services and support can feel fragmented for reasons as basic as a lack of knowledge about programs, distance, and lack of reliable transportation, or even facing the stigma that comes with asking for help. Even something as simple as a dead phone can interrupt engagement. But these circumstances really challenge us to think beyond our traditional outreach models. And while we might have great services and amazing outreach team, we need to answer the question of how do we connect with veterans who aren't walking through our doors or engaging traditional systems of care and support. So while it may be difficult to build and maintain that connection with certain veteran clients, our approach isn't limited to just veterans coming to us. Rather, we can start assessing how to meet veterans where they are. And so today we'll look at 3 different approaches to veterans outreach to ensure no veteran falls through the cracks. So our conversation will delve into stand downs, mobile medical units, and safe parking programs to help support this work. Today we have 3 wonderful panelists. I'll go ahead and list their names and introductions. First, we have Kenny Brummer. Kenny is a program analyst in the Homeless Patient Aligned Care Team, or HPACT, the National Program Office at the VA, where he supports primary care teams that provide medical care and other clinical service to homeless veterans. And Kenny has also worked in VHA since 2009 as a social worker in mental health, homeless programs, and caregiver support. We'll also hear from Andrew Morales. Andrew is the Director of Programs at Safe Parking LA, bringing 15 years of experience in youth services, homeless prevention, housing, and domestic violence programs across Southern California. He spent 13 years at Human Options in Orange County, rising from children's program supervisor to residential program administrator, where he improved shelter policies and secured federal funding for capital improvements. In his current role, Andrew leads multidisciplinary teams, delivering safe parking, case management, and supportive services to individuals and families experiencing vehicular homelessness. He manages multiple city-funded contracts, oversees compliance and performance metrics, and has launched new programs in partnership with local municipalities. His approach centers on data-driven program management, staff development, and collaborative partnerships aimed at expanding access to housing and advancing Safe Parking LA's mission to end homelessness. And last but not least, we have Akila Templeton. Akila is president and CEO of Veterans Village of San Diego, or VVSD, a nationally recognized nonprofit serving more than 3,000 veterans annually through a full continuum of services, including transitional and permanent housing, mental health and substance use recovery, employment support, and homelessness prevention. She oversees a multi-million-dollar budget and a staff of more than 200 and has led the organization since 2020. With over 2 decades of nonprofit experience, Akila is a prominent voice in veteran services, housing, and behavioral health. She testified before the House Committee on Veteran Affairs in 2021 on veteran homelessness during COVID-19 and holds leadership roles with CAVSA, the San Diego Continuum of Care Advisory Board, and the RTFH Board of Directors, among others. Her leadership centers on equity, trauma-informed care, and low-barrier service models, with a particular focus on reducing disparities affecting Black veterans. She's committed to achieving functional zero veteran homelessness in San Diego and beyond, has been recognized 5 times by the San Diego Business Journal as one of the region's most influential leaders. All that said, we're going to go ahead and get started with the presentations. Kenny will go first, Andrew second, Akila third, and Kenny, you have the floor. Thank you.
All right, great. Thank you. Happy to be here with you, everybody. As Jay said, my name is Kenny Broomer. I'm a program analyst with the VA Homeless Programs Office, and I work specifically in the Homeless Patient Aligned Care Team National Program Office. And I'm here with you today to share some information about what HPACT is and about our Mobile Medical Unit program. Next slide. And next slide, please. All right, so HPACT is one of several programs that are operated by the VA Homeless Programs Office, and together we provide a continuum of not just housing, but also employment services, legal assistance, outreach, and clinical care, with the goal of all working in tandem to support the ending of veteran homelessness. So HPACTs are primary care teams similar to the standard patient-aligned care teams in VA that provide mental health care, housing services, case management, and clinical wraparound services to homeless vets and vets who are at risk of homelessness. One of the big differences between HPACT and standard PACT in VA is that HPACTs are designed to provide proactive care that's especially easy to access and well integrated with other services that homeless veterans need. So we want to offer homeless veterans a user-friendly, efficient experience of consuming healthcare and other services from VA. Our HPAC teams consist of a prescriber, which is either a MD, nurse practitioner, or physician assistant. We also have nurses, social workers, clerks who help schedule appointments and run the clinics, and other disciplines like physical therapy, occupational therapy, pharmacists, and dietitians. In addition to providing all of the standard clinical care, HPACT is also a platform for new projects and initiatives like the Mobile Medical Unit project that I'll describe later for you. And just so you get an idea of the size and scope of HPACT, as of fiscal year 26 so far, we've got 65 HPACT sites across the country, and we serve about 23,000 veterans per year. Next slide. Okay, our mission in HPACT is to identify and engage veterans experiencing homelessness in a multidisciplinary, population-tailored medical home, which essentially means this is their place in the VA. If they need something, they come to the HPACT team, and if the HPACT team can't provide it to them, they will help them get what they need. So it's a one-stop shop where we can address the unique needs and distinct challenges that veterans face in accessing and engaging in care. And our vision is that all veterans will have access to high quality healthcare services that are well integrated and coordinated and address their physical health, mental health, and their social needs. Next slide. Okay, so in HPACT, we're driven by our 5 core elements. The first is reducing barriers to care. We all know that homeless individuals can experience barriers to receiving healthcare. So HPACs provide open access care. In addition to having the ability to schedule a regular primary care appointment, HPAC teams maintain a certain amount of time each week where veterans can just walk in for an appointment without having scheduled it in advance. Some HPAC teams also offer walk-in care in community locations away from the VA to be more user-friendly for homeless veterans. HPACs also offer one-stop wraparound services. So we want a veteran to be able to come in and get as much done in a single sitting as possible. Sometimes it's a real challenge for homeless vets to make it into the VA or to a clinic. So we want to help them get as much done as they can in that single instance of care. So as I mentioned before, that can be medical care, mental health care, also referrals to homeless programs. And often when homeless veterans come into HPAC clinics, they have some additional concrete resource needs. Maybe they need a change of clothes, maybe they need a snack, maybe they need some hygiene items. Some HPACs even offer showers and laundry. HPACs also offer intensive case management. Not every single veteran who enrolls in a HPAC will need intensive case management, but part of the process of a veteran entering HPAC is the HPAC team determining what the veteran's needs are and if they need intensive case management. I think for any individual, navigating healthcare and complex medical systems can be a challenge, but it's especially challenging for homeless veterans. So for veterans who do need that extra assistance with determining their needs, figuring out what referrals they need, figuring out what they need from outside of VA, and not just giving the veteran a phone number or referral, but helping them see through the process all the way through to completion is what's provided in intensive case management. HPACs also provide high quality, evidence-based, and culturally sensitive care. It's not uncommon for homeless individuals to have bad experiences in healthcare environments. So HPAC teams really do their best to make sure that it's a welcoming environment for veterans who are experiencing homelessness so they can feel comfortable and can trust the HPAC team. HPAC teams are also performance-based and accountable. We use a variety of real-time data and predictive analytics to assist teams in targeting specific veterans who are most in need and monitoring team performance over time. Next slide. I realized I put too much information in these slides, so some of them I'm just going to skim and go over really quickly. So HPAC's been around for a while, and there's been a bit of research done on HPAC. One study found that HPAC enrolled veterans have lower rates of emergency department utilization and lower rates of hospitalization. Those are two big goals of HPAC, is to help keep veterans healthy as outpatients through primary care so they don't end up needing to go to the emergency department and don't get so sick that they have to be hospitalized. Another study found that HPAC enrolled veterans cost over $9,000 a year less to care for compared for homeless veterans enrolled in standard primary care. And another study found that veterans enrolled in HPAC were more likely to report positive experiences with their access, communication, office staff, providers, and the comprehensiveness of care offered in HPAC. Next slide. Okay, so now that I've set the stage by describing our standard office-based HPAC, I want to talk to you about one of the offshoots of our HPAC program, which is our mobile medical unit program. Next slide. So as I've already mentioned, homeless veterans often have barriers to receiving medical care, and they often have unmet medical and mental health needs. So one potential intervention is to bring the care directly to them in a mobile medical unit, which is essentially a mobile primary care exam room. Next slide. Back in 2022, we were able to offer a competitive funding opportunity to all existing HPAC sites across the country to apply for a mobile medical unit. We had two different styles of vehicle available, a large and a small mobile medical unit. Ultimately, we were able to award mobile medical units to 25 HPAC sites. The initial award notification was in October of 2022, and then we had to go through the process of having the vehicles built. So in the end, the idea is that the mobile medical unit makes the HPAC team able to take care on the road and give them the necessary infrastructure that they need, the safety and the confidentiality and all of the medical gear to supply care in the community. Next slide. All right, so fast forward to August 2023. This is a picture of the ribbon cutting for the first HPAC mobile medical unit that was delivered to the Orlando VA. On the left, I'm not going to go through all these sites, but you can see if you take a look, all of the different sites that received a mobile medical unit and whether they received the smaller or the larger vehicle. So I'd encourage you to take a look at that and determine if you've got an HPAC mobile medical unit in your community. Next slide. All right, so here is a snapshot of what the vehicles look like on the inside. So these are architectural renderings of the design process. So on the left is the 27-foot larger mobile medical unit. The picture in the center, it's hard to see, but on the far left, there's a bathroom. So there's actually 3 rooms in the large MMU. We've got a bathroom on the far left. Then in the center where you see the white door, that's the entry door for patients and staff. That opens to sort of a nursing station waiting room. There's a bench seat for the patient. And then on the opposing side, there's a desktop, refrigerator, a place to sit for most likely nursing staff. Then in the middle, there's a partition wall with a pocket door, and it opens up to the 3rd room in the back, which is the exam room. If you look on the right-hand side, you can see the Sprinter version of the mobile medical unit. The big difference is that it's just one open bay in the back. There's not separate rooms. So one thing that I think is neat about the Sprinter is, in about 2 steps, you can go from being on a curb on a city street to being inside of a primary care exam room. And both vehicles have the same equipment, exam table, all of the different scopes and vitals units that you need for a standard primary care visit, refrigerators, cabinetry, countertop, and a wheelchair lift in the back. Next slide. These are some pictures of the finished product. Again, we've got the larger MMU on the left. You can see inside the first picture on the far left is the entry room that's sort of the nurse's station, and you can see the partition wall that leads back to the exam room. And in the F550, you can see in the second picture on the right, it's a pretty spacious exam room for being inside of a vehicle. It looks very similar to a standard primary care exam room that you'd see in most medical settings. On the right-hand side, you've got the Sprinter MMU. And as I mentioned, you can see in this picture, someone stepping into the vehicle. You take one step in, you're in the exam room. The layout is similar to the F550, although slightly different. It's narrower and a little bit longer. But we're really happy with how these vehicles turned out. Next slide, please. All right, so as I mentioned, each vehicle has the same equipment and exam table. They also have point of care testing analyzers for COVID-19 and flu A and B. They've got all the scopes and vitals equipment on the wall and a wheelchair lift where veterans can enter through the back of the vehicle. Most MMUs offer very similar services out in the community, which are medical, mental health, and social service needs can be addressed as well. Some HPACT MMU events target established patients. So they may take the vehicle to a transitional housing facility where they know that there are established HPACT patients and see them there. Some HPACT MMU events may be more in an outreach capacity and go to a location where they're trying to recruit new veterans to become HPACT patients and enroll with VA care and receive homeless program services. They also loop in other services like VA housing programs come along, and also sometimes VA eligibility services, because sometimes homeless veterans have difficulties with eligibility. Maybe they've not accessed the VA before, or maybe they're uncertain of their eligibility status. Next slide. All right, I know I'm running short on time, so I'm going to go fast in these last few slides. So here you can see the two vehicles side by side and get a sense of the size difference. And as I mentioned before, the HPAC team is the core of who staffs the MMU, but it's also really important to have collaboration with local homeless programs, other VA services, and community partners so that we can try to bring as many services out to veterans as possible when we have an MMU clinic day. I think it's a great experience for veterans to approach this vehicle, maybe not knowing what's available to them, and then have their expectations exceeded when they learn what's available at the MMU. On this slide, you can see some news coverage of HPACT MMUs. If you do a news search, you'll find a bunch of different local news stories, positive stories about HPACT MMUs. Next slide. Next slide. So we're still in the early days of the MMU program. All of our sites are up and running. We've had an increase in MMU utilization year over year since the program started. And we've also noticed that we're serving a substantial number of veterans who are new to VA care, meaning that they've been not seen in at least 36 months by the VA or potentially never seen. So that helps us know that we're reaching veterans who otherwise may not come into a VA hospital. Next slide. Okay, I just want to wrap up by acknowledging some of the lessons learned and challenges. So obviously, to provide medical care in 2026, you need an internet connection. So we're working to help our HPAC teams get reliable internet connectivity in all of the MMUs. These vehicles are staffed by clinicians who work in a regular clinic-based HPAC setting, so they have to split their time between the clinic and the vehicle. So that's something that sites are having to figure out, and also the logistics of driving, parking, and maintenance. We have doctors, nurses, social workers driving these things. They don't require a commercial driver's license. So it's a learning curve for some folks to learn how to operate the vehicle. Next slide. All right, so just want to end by acknowledging that the VA HPAC MMU program is the largest integrated mobile health program serving veterans experiencing homelessness in the US. We think it's a very promising practice, and we're looking forward to serving increasing numbers of veterans with our MMU program in the coming years. Thank you all for the work that you do, and thank you for listening to my presentation. Take care.
Thanks, Kenny. All right, we're going to move over to Andrew. Andrew, you're muted.
Thank you for the heads up. Hi, everyone. Thank you so much for joining us. My name is Andrew Morales. I'm the Director of Programs for Safe Park in LA, and I'm so excited to be here with you all and to share about the great work we're doing and how we can collaborate. Next slide. Here at Safe Park in LA, we employ underutilized parking lots to support specific needs of those Angelenos who are using their shelter, excuse me, are using, wow, let me start over. Excuse me, everyone. Safe Park in LA employs underutilized parking lots to support the specific needs of Angelenos whose only source of shelter is their vehicle. In addition to that, we not only provide a safe place for our participants to park, but we also offer services on top of that that help stabilize the participants and take into account their health and wellness and make sure that we're opening doors for them to find housing opportunities. Safe Park in LA was founded in 2017 and has evolved to become the largest safe parking provider for those experiencing homelessness and living in their vehicles. You can go to the next slide now. At Safe Park in LA, our mission is to provide safe overnight parking to facilitate stability in housing in Los Angeles County for individuals living in their vehicle and advocates for fair and equitable treatment and resources for the unhoused. At Safe Park in LA, our vision is for all individuals and families living in their vehicles to have an expedited path to housing through a system that opens doors. Next slide. Our program. So this next few slides are going to go into how our participants matriculate through our program and find a stable housing. We share that there's no wrong door to connect with us. You can call, email, and we also do in-person appointments to integrate our participants into our program. So we operate a community warm line and an intake. That warm line is assessing participants where they're currently at, and they're collecting documents such as a driver's license, car insurance, car registration. And we're trying to also remove those barriers. If those participants do not have a current valid driver's license, current registration, current car insurance, that is okay for us. We want to get to a yes. So let us know where you currently are at with your documents. Send us what you got. We'll review them, and then we'll work on a plan to either upgrade them or collect them or extend the payment for them. So we want to make sure that our participants have compliant documents whether driving on the roads, whether they're a veteran or not. We operate safe parking lots where we have security, hand washing stations, and porta potties for our participants, where they have access to showers and laundries and access centers to make sure that they are provided from those basic necessities while on our lot. And again, it is all focused and centered around stability and self-sufficiency. So whatever that may look like for that particular person or family. Next slide. As you can imagine, this will be very difficult to do by yourself. And so we want to make sure that we're trying to remove that isolation for our veterans that are experiencing homelessness. They will be assigned a case manager, and that case manager is well-versed in VA benefits and housing navigation and creating what we call a housing stability plan. We share that we are the passenger, they are the driver, and we're just helping them navigate through the roads of finding and securing housing. We cannot do this without emergency funds or financial assistance. As I shared earlier, it's okay if they don't have current registration and current insurance, as we have financial assistance to help them become document compliant. They get access to that right away. One of the things that's also been beneficial for our participants is we give them access to a AAA membership the moment they enroll with us. We want them to be able to self-resolve, be able to find their way back to our location, and that way they're able to self-sustain themselves without having to depend on someone to get them back to our lot. We also provide linkage and referrals to housing. We will work with our participants and putting them on lists and helping them fill out applications. If there is a fee associated with those applications, our staff members or case managers are well equipped to make sure that they are helping them collect the documents and submitting them in a timely manner. From there, it's about building that rapport with our participants. Our staff go out to the lots on weekly to engage with our participants, and then throughout the week, they are meeting with our participants where they're at. So a lot of times that could be at the VA campus, it could be in our office, it could be out in the community. We really try and remove barriers to accessing us as well. Next slide. Oh, sorry for the number 3. It looks like the font got a little squished, but we operate 5 lots within LA County. Of course, the one we're speaking about is at the West VA campus on the west side of LA, where we're actually on the VA campus, was unique to a lot of service providers. We are really thankful for our collaboration with the West LA VA campus to remove that access barrier to our participants. We have a great relationship with our VA PD, who's also bringing those folks that are experiencing homelessness directly to our front doors. We also share that even if that same day that they're being referred to us, they do not have that current documents, that's okay. Please come park with us. Please get a meal. The next day, our case manager will follow up and help walk you through the application process and to ensure that this is a good fit for that person that decided to say yes to us. Next slide. So this next slide goes specifically into what's different about the VA campus versus our other general population lots. As I shared, we were actually on the VA campus. We are able to directly access VA benefits and support our participants. We also participate in the by name list group where we are case conferencing individual veterans and ensuring that they are getting connected in the service that they deserve. A highlight of this program is they are getting nightly meals in collaboration with local food partners and of course our VA partnerships that are helping us deliver the food nightly. As I shared before, there's on-site case management. Each participant will get their own individualized housing stability plan. And again, that's to identify what are their housing goals. And then let's find a way how we're going to navigate and get you to that goal. And then the next is housing navigation and community referrals. We want to ensure that our participants know that they're not in this alone. Our case managers will attend those housing appointments with you. They will provide a gas card to go look at the housing. They will provide advocacy on your behalf with landlords if needed. There are a few eligibility requirements for our participants, being that we actually are on the VA campus. They will need a DD-214 card or the VA card, and they need to have a discharge status of at least other than honorable to be on the VA campus. However, if they do not have that status, they are still welcome to all of our other sites, and they will still get the same level of care. However, it just will not be on the VA campus itself. Next slide. This program, unfortunately, is potentially experiencing a funding cliff come the end of September. We no longer have a contract with the city. We are running this organization, we're running this site out of our general dollars. And so we need your advocacy. We want to make sure that this program continues on. So there's multiple ways that you can get involved. One, you can refer a participant to us directly. Like I said earlier, there's no wrong door. Please send them to our website. Please give them our phone number. And later on, you'll have my email as well. We want to make sure that we're speaking to everyone so that we can get to a yes and engaging with them. Aside from that, there's also an opportunity to make donations directly to us so we can ensure that this proven intervention can sustain and support the veterans. I'm not sure if everyone's aware, but we are the only safe parking programs specifically addressing vehicular homelessness in the United States. And we do not want to lose this vital resource for the community. Next slide. As I shared, you definitely have my information. We have a community warm line number there, our warm line email where the staff receive applications directly, and of course myself. If there is a reason for someone that needs an expedited path into our programming, I want to make sure you guys know that I'm available to you, so please reach out. And with that, that concludes my presentation.
Thank you for that presentation, Andrew. All right, Akila, take us home.
Okay, good afternoon. It is a pleasure to be here to talk about Stand Down. Thank you for the invitation. It is especially fitting because we just wrapped our 38th annual Stand Down this past weekend. So today I want to talk about Stand Down not just as a 2 to 3 day event. I'm sorry, I have some background noise there. I hope you can't hear that. Not just as a 2 to 3 day event, but also as a community strategy. And so San Diego's Stand Down, for those of you who don't know, began in 1988. And the model has now been replicated in communities across the country. And that history is important, that history matters, but what continues to be important is how the model continues to evolve. And so we are no longer simply bringing services into one place for a few days. We are using Stand Down to reach veterans who may not otherwise come through the normal door. So the door of a provider, a VA clinic, a shelter, or a benefits office. And so the theme that I am really wanting to uplift today is this, and that is that if we want to reach the hard to reach veterans, we have to begin to build relationships before we expect outcomes. We have to remove barriers before we ask people to engage. And we have to treat Stand Down as part of a year-round strategy and not simply an isolated event on the calendar. And so the challenge, why is it that some veterans never reach our doors? And so one of the most common questions that people ask is, if help exists, why are so many veterans still disconnected from care? And we all know, as you've heard from our previous presenters, the reasons are many, right? The answer is rarely that veterans do not want the help. More often, there are layers of barriers that make accessing help extremely difficult. Some veterans are simply not aware of the services that are available. Others have tried to access services in the past and had difficulty, or maybe they've had a bad experience. Some look at the eligibility requirements and the paperwork and just become overwhelmed with the process, and they may not have the capacity to actually take it from start to finish. And so we also have to remember that homelessness creates its own daily crisis, right? So if someone is focused on finding food or protecting their belongings or staying safe, then completing paperwork to get things done may not be the first priority. And so we have to think about those things and things like behavioral health challenges that can add another layer of barriers and really make system navigation much more difficult. And then there is just, simple dignity. A veteran who has not showered in days or weeks, for example, may not be inclined to seek out services. And so perhaps instead of asking why it is that veterans don't come to us, maybe the better question is, what barriers have we unintentionally created, and how can we begin to remove those barriers? Next slide, please. Next slide, please. Okay, and so let's talk about how the event has moved from just an event to a year-round engagement strategy. And that was the previous slide there. So San Diego Stand Down, as we mentioned, was established in 1988. And it has become a part of the national history of veteran outreach, and we're very proud of that history. What started as an urgent response to veteran homelessness has grown into a model that communities across the country have adapted to their own local needs. But the model itself cannot remain frozen in time. The needs of veterans have changed and they continue to change. The housing market has changed. Behavioral health needs have increased. More veterans are attending our events as older adults. We also know that we have to think about prevention now. More veterans attending are older. We're thinking about family members, active duty service members, and those who are preparing for transition. So that is key to that prevention piece. For us, Stand Down is no longer just about what happens during the event. It is also about what happens before the event, during the event, and of course, after the event. It has become a launch pad for engagement. It is a way to bring the system together. It is a way to identify gaps, to test solutions, to make sure that veterans who have been outside of the system have an actual open door and a way back in. So how has our reach expanded and who does Stand Down serve today? And so historically, people have often thought of Stand Down primarily as an event for homeless veterans, and that is true. That is still central to the work that we do, but the population has expanded. Today, we serve veterans who are unsheltered, as well as veterans who are at risk of homelessness, and then their family members, active duty service members, and those who are transitioning out of the military. That matters primarily because homelessness prevention is just as important as the crisis response. And so if we can reach a veteran before they lose the housing or connect a transitioning service member before the crisis happens, then we are using Stand Down in a much more strategic way. And so this broader approach acknowledges that veterans do not experience instability and isolation. Families are affected, caregivers are affected, children are affected. And so the veteran support system is a part of the solution. And so when we think about Stand Down, we should think about it as a continuum that includes prevention, outreach, immediate support and stabilization, housing, recovery, and then of course, my favorite part, that long-term connection. They always know where to go to tap back in. They can count on the fact that there will be another Stand Down happening that next year. Next slide, please. And so today's veteran population is changing. Next slide. And here you can see some of the age and service implications. One of the most important trends that we're seeing is the aging of the veteran population attending Stand Down. And so looking at our 2024 data, you see that approximately 1/3 of the veterans who attended were between 61 and 70 years old. And then there is another significant group who attended between the ages of 51 and 60. And so when you combine the older age bands, then we see that half of the veterans who participated are over age 60. And if you include those who are 50, then the number grows even larger. And so that tells us something very important, and that is that we are not only planning outreach events, but we are planning services for aging veterans who may have mobility issues, chronic health conditions, and more complex healthcare needs. And so this should help to shape how we plan the event. It affects transportation. It affects how far people have to walk to attend the event. It affects whether seating is available. It affects access to medical care and benefits navigation. It also means that we need to be thinking about age-responsive care and not just veteran-specific care during these events. And so when we talk about hard to reach veterans, we should remember that some are hard to reach because the system was not designed around their current stage of life, and that's very important. Next slide, please. So what does it really take? I wanted to touch briefly on the scale of the partnerships and the investments. Stand down is very expensive. For our local event, the cash, buy-in is typically $100,000 to $130,000 that comes out of our bottom line and through fundraising. But then when you add in the services that are provided, all of the in-kind donations, it really grows to be about a $300,000 to $400,000 commitment. And so this year, we had roughly 300 volunteers from start to finish. And so when I say start to finish, that means all year long planning, participating in the events that lead up to Stand Down, and then participating in the actual event itself. In prior years, that number has been as high as 500 or more. And I'm sharing these numbers because they make one thing clear, and that is that no single organization can really do this alone. Next slide, please. Okay, and so I want to talk a little bit about innovation through collaboration and the fact that Stand Down has become a launch pad. One of the most exciting things about Stand Down is that it creates a space for innovation. So when you bring partners together around the immediate needs of veterans, you begin to see those larger systemic issues more clearly, and we can tackle those systemic issues during the event. And so we've done things like introduce a landlord hub so that landlords can come out and learn about landlord incentives. We've added mental health panels and a mental health summit. This year, we partnered with the Cool Air rebate program because we found it to be particularly relevant to what is happening today. We have a lot of people living in their cars, people exposed to extreme heat. And so this program offers free repairs to cooling systems. And we had over 200 veterans sign up. And so Stand Down becomes more than a service event. It becomes an innovation lab, and it gives communities a place to test ideas and build partnerships and identify gaps. And then, of course, a place to launch those solutions that we hope will continue throughout the year. Next slide. I'm going to talk about, next slide, please. Collaboration as the secret ingredient with the veteran at the center. And so when we talk about partnerships, we should not only list agencies, we should be thinking about how those partners connect around the veteran. And so that is why collaboration is not just a soft concept, it's an operational strategy, and it's one that we use to reduce barriers, increase trust, and improve outcomes. And I'm just going to speed up a little because I'm almost out of time here. Let's go to the next slide and just talk about the growing impact across the years. On this next slide, you'll see that there have been some fluctuations in the numbers served, and there are reasons for that. I mean, at its peak and its heyday, you may have 1,000 to 2,000 people attending a Stand Down. We've had a significant decrease in veteran homelessness over the past 2 decades, and that is due in part to events like Stand Down, which we know work and are extremely effective, and some of the programs that have sort of grown out of the event. Next slide, please. And so we want to make sure that we are providing services that restore dignity. And so some of the basic services that we provide at Stand Down, in addition to some of the larger and more popular ones, are things like meals and showers and haircuts. And you can see those things represented on those on that slide. These are not just side services, they're actual engagement tools, and they make the next step possible. Next slide, please. And so then from service connection to stability, ultimately the goal is not just to serve people during Stand Down, the goal is to connect people to stability. And we'll move on to the next slide. So more than an event, if we look at the evolution of Stand Down, I think about it in 3 stages. Yesterday, Stand Down was primarily about providing services through an annual event. Today, Stand Down is about building relationships, coordinating across systems, and using the event as a platform for innovation. tomorrow, the opportunity is even bigger. Stand Down can help to transform systems. It can help communities prevent homelessness, and scale what works and identify where the traditional system is failing so that we can reach more people. And so the future of Stand Down is not simply larger events, it is stronger systems. And so if we do this well, Stand Down becomes the visible expression of relationships and partnerships that exist all year. I had at least 2 more points to get across, but I am going to be a good panelist and end on time. Thank you so much for having me.
Thank you so much, Akila. We're going to start our Q&A now. So if all of our panelists can hop back on camera and unmute themselves, and we'll go ahead and get started. So first question goes to Kenny. Do you have any idea as to what the prospects are of getting MMUs out across all 50 states?
So the VA does have MMUs that are not specific to HPAC. So the 25 HPAC MMUs that I showed in the list are not the only MMUs that VA has. As far as expansion of MMUs, currently, I don't have any information to share about whether MMUs will be awarded to additional sites in the future. Sorry, I wish I had more to tell you, but I don't have information on that at this point.
Yeah, no worries. But I'm just curious though, as far as like how the day-to-day locations of them, how are those determined?
For the sites that do have them, how do they decide where to go?
Yeah.
Really, it's up to them, and we often recommend that they collaborate with their local healthcare for homeless veterans outreach staff at their VA medical center, because typically the outreach staff at the VA have pre-established outreach locations throughout the community. Those could be potentially encampments, homeless shelters, day centers, other places where they know they're likely to encounter homeless veterans. So instead of reinventing the wheel and coming up with new outreach locations on their own, we ask them to collaborate with HCHV to find out what are the existing places where they know that they're likely to encounter homeless veterans. That said, it's absolutely at the discretion of the HPAC teams. If they want to start a new outreach location, they have the discretion to do that. And I think, as I mentioned in the presentation, it's also common for HPAC staff to take the vehicle to project-based HUD BASH housing where they know that they're likely to encounter established HPAC patients or patients who want to enroll, transitional housing, and also grant and per diem programs. They also participate in stand downs, and they also could determine a community location that's not necessarily tied to a housing facility, and set up shop and do an outreach day really at any location in the community that they feel would be worthwhile.
Thanks, Kenny. All right,
Sure.
I have a question for Andrew. So where are some of the prime areas to leverage to increase the presence of safe parking programs in our communities?
Sorry, Jay, say that one more time. It cut out a little bit.
Basically, where are some of the key areas that we can start identifying as a way to increase the presence of safe parking programs in the community?
Yeah, I think it's important to build rapport with anyone first. A lot of times we see those vehicles on our streets that kind of just look that someone could be experiencing homelessness. And so we have tear cards that I would love to send out so that people can literally put on people's dashboards, their windshields. If you're engaging with someone, let them know that there's services available to them and that there's direct access immediately within 24 hours that they could get connected. As I shared earlier, we're on the VA campus. However, we do not only serve veterans at the VA campus. We serve veterans throughout all of our sites. So it's throughout LA County that we're able to provide services for all those folks.
Excellent. Thank you, Andrew. Let's see here. I see a question for Akila regarding some outreach strategies on aging veterans. Is there anything specific that you would recommend for providers to improve their ability to connect with those aging veterans in our community?
Yeah, I mean, one of the things that we can do is to design programs with them in mind, right? And so that is what you heard me sort of talking about when we plan Stand Down. So we're thinking, is this event going to be accessible Is it going to be comfortable? Can we provide transportation? Are we connected to organizations that serve our aging veterans? And so in most instances, when it comes to outreach, we are actually going to them and telling them about the services that are available. And if necessary, we're bringing them out to the stand down event. But I would say that the same is true across the board, that if you are trying to engage with older veterans, outreach is not just about the street outreach piece. It means connecting with organizations that serve that population. It means going into hospitals and nursing facilities. It means educating family members. We do a lot of work in the way of teaching family members how to advocate for the seniors in their lives. And so when it comes to outreach, it is a multi-pronged approach. There are several ways to do it, but the most important thing when it comes to seniors is to really think about how to make it easier for them to tap in.
Thank you, Akila. And I have a question for all three of you. And this is kind of a common thread or theme that I've noticed between all of your presentations, but it's this idea of building trust with the veterans in your community. And so Andrea asks, what tactic do you guys use for veterans who might be a bit more reluctant to engage in services? So what does actually building trust look like?
Well, I would say it's
okay.
Go ahead.
Go ahead, Akila. Sorry.
Well, okay. I would just say that it's persistence, it's consistency. Veterans know that they can count on Stand Down being there every year. So if we didn't catch them year one or year two, from the time that they first became involved, they know that that event is going to be happening the next year. And so I think that that is one of the ways that you start to build trust. They can trust that that event is going to happen. Those services are going to be there. And if they want them, we can connect them. So that's one way that we do it.
Thanks, Akila.
Mm-hmm. I'll jump in. I definitely echo Akila's comments. And what I would add to that is it's important for peer-to-peer engagement as well. It's great when a person has successfully gone through our program and is able to advocate on behalf of another participant, or, hey, letting them know, I went through this program. I know there's actually a staff member you can connect with right away. It's something about that peer-to-peer, I've been through this experience, better than, hey, I'm a service provider. Here's something that you should be able to use. And it's like, no, here's a participant, I've gone through it. I'm proof that they respond and there's access at the end of the day. So yeah, peer-to-peer engagement is so important as well.
Yeah, I like what you said about that because it underscores the importance of lived experience in this whole realm. And also just, being able to share those stories and being able to elevate, the efficacy of these programs. Thanks, Andrew. And then Kenny?
Maybe I'm just repeating what's already been said, but I think really reliability and consistency are really important in HPACT. I think when patients come to the HPACT team, maybe it's been an ordeal for them to come have this medical appointment. So whatever is offered to them at that medical appointment, whatever sort of promises are made, it's really important that the follow through is there. And I think that that's what helps the veterans gain trust when they encounter providers who lay out the menu of options and then help the veteran see it through in a persistent way, not just a flash in the pan encounter, because I think that sort of follow-up over time helps veterans, at least who are served in HPAC, to feel like the team is trustworthy and they'll do what they say.
Thanks, Kenny. All right, so we have some questions on the numbers now. Akila, you talked a little bit about the money side of stand downs, but folks are interested in Andrew and Kenny on how much funding is available for your guys' respective programs. So we'll start with Andrew first. Latoya is asking, how much is the annual funding for Safe Parking LA?
Thank you for the question. So we do not have a contract currently, and so we are paying out of our general funds, but roughly to do a year's services, we're about $450,000 a year, which covers security, the sanitation units, of course, the case management, and the financial assistance services for our participants.
And then Kenny, the cost of one MMU, and how do you get that funded?
I don't have the cost off the top of my head. So originally the whole group of 25 MMUs were funded at once with American Rescue Plan funds. And then they were allocated to each VA medical center, and those medical centers are now responsible for, the follow-up cost of operating the vehicle. But feel free to reach out to me at my email address in the slides, and I could get you a follow-up answer.
Definitely, and that's a great reminder for me. So I had a few questions during the presentations asking for the contact information. All of the contact information will be in the slides that we'll send you all in the follow-up email. So just keep an eye out over the next 24 hours and just scroll through the sides and you'll see the panelists' contacts. There's a question here on the Landlord Hub. Okay, if you can go over that just one more time for Abigail. I'm also interested in the Landlord Hub.
Okay, yeah. So a couple years ago, there was an initiative here in 2024. There was an initiative here in San Diego called the Leave No Veteran Homeless Initiative. And so while we were planning for Stand Down, we were also participating as a region, many of our service providers, in this Leave No Veteran Homeless Initiative. And so during those planning meetings, a light bulb went off. We said, hey, we have Stand Down coming up. Why don't we use this as an opportunity to educate landlords about the various incentives that are provided by all of our organizations? We can have landlords actually come out. They can see the clients that they are going to be serving. They can even meet with them and take applications on the spot. They can learn about case management. They can learn about some of the challenges that our veterans face. And so that was one option, but it was also a way to educate our veterans about some of the programs that are out there so that we could sign them up for some of the various incentives that might be available. And so it was just this really innovative approach to solving the problem of getting the word out, because a lot of the landlords were misinformed. A lot of them were afraid. A lot of them just didn't understand how some of the incentives worked. And we had several at the time. There were, incentives being offered by the city through our continuum of care and through the VA. And so this was a way for landlords to come out and learn about all of them and then hopefully take advantage of them and agree to house some of our veterans. They could see how easy the process was, and they, would become hopefully more excited about working with our veterans to house them.
That's a great way to interface with that specific population and bring them on board to support veterans. I really have a lot of interest in hearing more. We'll chat offline. Okay. I do have one last question before we close out. I know we started a little bit like 3 minutes late, but I'd like to keep the hour going. But to kind of cap off our conversation, I'm just curious, knowing your guys' thoughts as a coalition, how can we improve provider approaches to connect with hard to reach veterans? So what gaps do we need to fill to make it easier to support those hard to reach veterans?
One of the gaps I'm seeing is cross collaboration as far as like site visits. We are describing what it might look like to participant, but we don't actually know what it looks like. So I think we could do a better job of having an open house of some sort. And I welcome folks to please call me and reach out. Let's set up a tour. So that way you can describe in detail what it looks like, what it feels like to enter a program. And I think cross collaboration like that would just help build that that rapport with the participant. Like, no, I've been there, I've seen it, and this is the actual person you're going to connect with. Would be very, very beneficial.
I think repeated contact and ease of accessibility are really important. I think sometimes for people who've been reluctant to participate in healthcare or housing related services, you never know when that one offer might be the one that they say yes to. So being persistent and continuing to offer services to individuals. And then when they do say yes, making sure that your processes are user friendly so that they don't hit some immediate barrier that results in them not wanting to continue. So having streamlined user-friendly systems.
Thanks, Kenny.
Yeah, I have to agree. I mean, we're all about collaboration here in San Diego. I think that is, the secret sauce. And so if we lead with relationships, before programs, right? And collaboration before competition, and dignity before bureaucracy, then you can't help but to have, better outcomes and reach those veterans who might not otherwise make their way through our doors. And so I'm really proud of what we do in San Diego and how our continuum of care works together to make sure that we're not duplicating efforts. It has helped us to become much more efficient at service provision. I think we're doing a really good job. I think the numbers show that. And so I'm just so proud of not only VBSD, but all of our partners who share in that way of thinking about problem solving.
Great. All right. So as we wrap up today's conversation, one theme has definitely shown through, that being hard to reach doesn't necessarily mean that that person is impossible to serve. More often, it means our system's approaches or points of access need to be more flexible, persistent, and responsive to where our veterans are in their lives. So we've heard about programs that meet veterans where they are, whether it's through the MMU program, bringing healthcare directly to communities, safe parking that creates stability and dignity for veterans living in their vehicles, or stand downs that bring together all the wraparound services and resources in one trusted locations. While these models look different, they really share the same idea. Don't wait for veterans to navigate those complex systems alone, and bring services to them and reduce the barriers that stand in the way. Akila, I like what you said earlier during your presentation, where you said that we need to remove barriers before we ask a veteran to engage. So as providers, our challenge is to continue asking that, how do we make it easier for veterans to access care? Or are we asking them to overcome obstacles we could remove? So I want to thank all our panelists for sharing not only the programs and successes, but also the lessons that they've learned. I'd also like to give the Home Depot Foundation another huge thank you for sponsoring this webinar. And of course, one last thank you to you all, the attendees, for doing such crucial work in serving veterans in their community. So we're going to cap off this webinar, but as a reminder, we do have another webinar on August 19th on supporting transitioning military service members, which will cover interventions for servicemen entering civilian life. So on that note, again, thank you all, and we'll see you in the next one. Bye, guys.
Thank you.